Good morning, everyone. My name is Christy McKenzie. I'm Assistant Coordinator of Neighborhood Services for the Erie County Department of Senior Services. I would like to welcome you all to our 2021 Virtual Elder Law Day Summer Series. This program will continue to run every Tuesday and Wednesday at 10 a.m. throughout the remainder of the summer, offering a variety of topics. We'll also be recording this presentation, and it will be available later on our website, also on YouTube. We ask if you are asking any questions today to type them in our question and answer panel, and please refrain from using any personal information. Questions will be answered at the end of the presentation. I would also like to take a minute to thank those individuals who have helped make this summer series possible, including our County Executive Mark Polenkar, our Senior Services Commissioner David Schenk, and Karen Nicholson, the CEO for the Center for Elder Law and Justice. Please allow me to introduce our guest speaker, Bria Lewis. Bria works for the Center for Elder Law and Justice and their long-term care resident advocacy unit. Bria represents residents in nursing home discharges and adult care facility evictions. During the pandemic, Bria worked with residents and their families advocating for increased visitation both virtually and in person in nursing homes and adult care facilities. Welcome, Bria.
Thanks, Kirsty. Hi, everyone, and thank you for joining us today. As Kirsty said, my name is Bria Lewis, and I'm a staff attorney here at the Center for Elder Law and Justice. I was originally supposed to be presenting with my supervisor, Lindsay Heckler, but unfortunately, she was not able to join us today. Just a reminder, please wait till the end to ask questions. There'll be enough time for a Q&A session. So with that, I'll begin. So the presentation today is Know Your Rights When You Enter a Skilled Nursing Facility for Short-Term Rehabilitation. So before I get started, I just want to start with this disclaimer. It's important to note that the following content is for informational purposes only, and it should not be interpreted as legal advice because some of the information may not pertain to your specific case or situation. So today I will be going over the hospital discharge process, the resident admissions agreement, the resident right to care planning and discharge planning, the current guidelines for visitation, outings, and communal dining, staffing requirements, where to turn if there is a complaint, and resources. So I really hope that at the end of this presentation, you'll have a better understanding of what your rights are as the resident, how to better advocate for yourself in different situations, and what resources are available to you and when you can use them in different situations that you may come across. So when you're in the hospital and it's time to start planning to leave, usually social workers or discharge planners are in charge of creating your discharge plan. But it's really important to remember that you are the expert about yourself. You know your physical limitations, your financial limitations, and you know the extent to which your loved one can provide care. So it's really important that you're an active participant in this process. It's also important to ask questions. Know what your options are for discharge. Is going to a nursing home the only option? What are the risks to returning home? You know, the more questions that you ask, this will just ensure a better health outcome for you and help you become more involved in your care. If you feel like you're having trouble being involved in your care, then you can speak with a hospital patient advocate. And in the guides that I have linked at the bottom of the slide, we have information on how you can contact the hospital patient advocate. The guide also contains questions, important questions that you can ask during the discharge planning process. So before you enter into a nursing home, you are going to be presented with the resident admissions agreement. And this is a very important document. It lays out the guidelines for both you, the resident, and the facility. So it's very important that you read through this document thoroughly. I've listed out here on the slide many things that cannot be in an admissions agreement, and I just want to touch on a couple of those right now. So an admissions agreement cannot require as a condition of admission that the resident enter into a binding arbitration agreement. And what this means is that if you agree to enter into an arbitration agreement, you would waive your right to pursue legal action in the court system if you are harmed. So that is not something that should be in an admissions agreement, and that is language that you should look out for. Also, an admissions agreement cannot waive or request that you as the resident waive its ability for loss of the resident's personal property. A nursing home must exercise reasonable care for protection of the resident's property from loss or theft. And this also depends on the needs of the resident. So if you have a resident that has dementia, then there's more of a burden on the facility to make sure that the resident's property is protected. Lastly, the nursing home cannot force a resident for them to be the Social Security representative payee. So as a resident, you have a right to manage your own funds, and that is not something that the nursing home has to do for you. We usually advise residents to try and avoid signing the admissions agreement before entering the facility. It's okay if you sign the agreement once you're there. This just gives you enough time to read through the document thoroughly, make sure that you understand everything that's in the document, and to ask any questions that you may have. I've also included a link to our nursing home admissions agreement guide at the bottom of the slide. So once you're in the nursing home, the first 48 hours can be a very hectic time for residents and their families. We suggest that you have a copy of your discharge plan from the hospital and your medical records. This will just help to ensure a smoother transition during this time. Also, during the first 48 hours of your time at the nursing home, they should develop a baseline care plan with you. So this is just going to go over your initial goals, any physician orders or dietary orders that you may have, and what services that you may need. It's important to remember that you decide what your goals are and you decide what your objectives are. So this is another time where it's important for you to speak up and ask questions. And if you don't receive a written summary of your baseline care plan within the first 48 hours, you should ask to have that baseline care plan done. So after the first 48 hours, within the first 21 days of your admission, the facility should go through the comprehensive care plan with you. So this goes into more detail than the baseline care plan. And this, again, goes over your goals and your desired outcomes. It also lists what your discharge planning goals are. And this is a fluid document. This is something that can change while you're at the facility. This is also reviewed quarterly plus meetings, and these meetings are called care plan meetings. And at these care plan meetings, you can have your family and others of your choice at the meeting with you. And this care plan meeting, while it has to happen a minimum of quarterly, it can happen more frequently if your needs change or if you have concerns that you would like to be addressed. You can just ask to have a care plan meeting. And again, it's really important for you to be an active participant in your care plan to make sure that your goals, the goals that you want, are going to be met. So like I just mentioned, discharge planning is something that you have the chance to be a part of and to go through with the facility, and they're supposed to help you create that discharge plan. And when you're planning to be discharged from the facility, you have to remember that you have the right to return to the community and any other living arrangement in the community as well. And it's important that the facility sets you up with services that you may need. to prevent readmission to the facility. So I just mentioned discharge planning, and when you go through discharge planning, that's when you're planning to leave the facility. So that is a voluntary discharge. An involuntary discharge is when the facility initiates the discharge. And there are only 6 allowable reasons that a facility can initiate a discharge. And those reasons are if the needs of the resident cannot be met by the facility. So if the resident's needs exceed that which the facility can provide services, then that's a reason when they can issue a discharge. Another reason is that the needs of the resident have improved sufficiently so that they no longer need the services provided by the facility. Another reason is that the safety of individuals is endangered due to the clinical or behavioral status of the resident. The health of individuals in the facility would otherwise be endangered. The resident has failed to pay, or the facility ceases to operate. So the main reasons that we usually see for discharge is that the needs of the resident have improved so that they no longer need the services of the facility, or that they have failed to pay. So I want to go over, if you received a notice for an involuntary discharge, it's important to note that the facility, like I said, can only discharge you for those 6 allowable reasons. So if it's not one of those 6 allowable reasons, then they cannot initiate a discharge. And if you do receive a discharge notice, you have the right to appeal that notice if you do not agree. In order to start the appeal process, you would do so by calling the New York State Department of Health at the number listed. And while that appeal is pending, you have a right to stay at the facility. You can also call the New York State Long-Term Care Ombudsman program to learn more about your rights during this time. And I'll go into a little bit more detail about what the Ombudsman program does a little bit later. You could also call our office for representation. So like Christy said earlier, I help with nursing home discharges and adult care facility evictions. So if you're in Western New York, you could call our office for potential legal help. And I've also included the link to one of our guides for nursing home transfer and discharge rights. So that just goes into more detail about the whole process of involuntary discharge and some frequently asked questions that people may have. So when you go into a nursing home, Medicare is one of the providers that can cover your stay. So Medicare Part A can cover up to 100 days of your nursing home stay for these 3 reasons. If you were in a hospital for 3 or more days prior to being admitted into the nursing home, if your physician orders skilled nursing or therapy services, or if you need skilled services that can only be provided in a nursing home. A lot of times we hear people say that Medicare won't cover their nursing home stay because they're not improving. This is absolutely false. And there was a settlement on this called JIMO. And what JIMO means is that skilled services should not be stopped just because you're not improving. So Medicare coverage depends on the need for skilled care, not on the presence or absence of potential improvement. And the standard now for if Medicare can cover your stay is these questions here. So is a skilled professional needed to ensure nursing or therapy is safe and effective? Is a qualified nurse or therapist needed to provide or supervise the care? If the answer is yes to both of these questions, then Medicare should cover your services regardless of if you're improving or not. And if the facility tells you that your services are being stopped or Medicare won't cover your services, it's important again to ask to have a care plan meeting, to ask why the services are being stopped. You can also contact our office for help with appealing if you want to continue your services. So during the past year with COVID-19, visitation has been a serious concern for residents and their families as far as visitation in nursing homes and adult care facilities. So I just want to go over what the current guidelines are right now for visitation, communal dining, and outings. On July 8th, the New York State Department of Health updated the guidelines for visitation. So I'm just going to highlight what some of those updates are. So visitation can be conducted through different means, such as in resident rooms, dedicated visitation spaces, and outdoors. During the pandemic, we had a lot of people say that they weren't allowed to have visitation in the resident room. So what we found was that if the facility is still conducting visitation in a designated visitation space, then they're still adhering to the guidelines, even if visitation is not occurring in the resident room. That is just one area of the facility where visitation can occur. Also, facilities are allowed to schedule visits. A lot of concerns that we had as well during the pandemic were that family and friends of residents that worked all day were not able to visit because facilities had very limited visitation hours. So it's important that facilities are having visitation hours, after 5 for families that work all day or on the weekend, to take those needs into consideration and to make sure that all residents are allowed to receive visitors. Compassionate care visitation should be allowed at all times. And as a reminder, compassionate care visitation goes beyond just end of life. There are different scenarios where a resident could have a compassionate care visit. A couple of examples could be if they're having trouble adjusting to the new environment that they're in, if they're experiencing emotional distress, if they usually have help with eating or drinking and they usually need cueing from family members. These are some reasons when a resident could have a compassionate care visit, and the facility will look at the specific needs of the resident and determine if they would qualify for a compassionate care visit. It's also very important to note that for visitors, being tested or vaccinated should not be required, and you should not have to show proof of such as a condition of visitation. So while New York State Department of Health encourages people to be vaccinated as soon as practicable, this is not a requirement for visitation. And also, if you are asked to be tested when you enter the facility, you can choose to decline and say that you don't wish to be tested and it's not a requirement for visitation. Visitation can occur during an outbreak, and what an outbreak means is that there is a new case of COVID-19 that happens in the facility. So when this happens, a facility can close down that area or unit of the facility and still leave the other remaining areas or units of the facility open for visitation. Now, if the facility continues to do outbreak testing and they see that there are more cases of COVID-19 popping up in the facility, then the facility is allowed to suspend visitation until they discontinue outbreak testing. Another important change in the guidelines is that if a resident is fully vaccinated, they can choose to have close contact, including touch, with an unvaccinated visitor while both of them are wearing a well-fitted face mask. And if both the resident and the visitor are fully vaccinated and they're alone in a resident room, or a designated visitation space, then they don't have to wear a face covering or a face mask, and they're allowed to have close contact as well. So a lot of people have stated that some facilities were still not doing activities or communal dining, but now, according to New York State Department of Health, these activities should resume in facilities. And with communal dining and group activities, if all the participants and residents are fully vaccinated, then they do not have to wear a face mask. However, if there are residents that are in the dining area or that are participating in the group activity that are not fully vaccinated, then everyone needs to wear a face mask, and those that are unvaccinated should physically distance from others. Outings is another issue that we have heard a lot of people have been dealing with during the pandemic. So right now, residents are allowed to leave the facilities for outings. An outing refers to a short leave from the facility for less than 24 hours, usually for a doctor's appointment or to visit with family and friends or to have lunch or dinner. The facility is required to have appropriate policies and procedures in place to address infection control and prevention before and after outings. A lot of people also ask, if a resident leaves the facility for an outing, do they have to quarantine upon their return? So according to the CDC, if a resident leaves the facility for less than 24 hours, then they do not have to quarantine. However, if they leave the facility for more than 24 hours, there's a chance that the facility may ask them to quarantine even if they test negative. The exception to this is if the resident had a COVID-19 infection within 3 months or if they are fully vaccinated. And on this slide, I just have a link to the current guidelines for visitation and outings for nursing homes. And I also have a link to a fact sheet that we have that just answers some frequently asked questions that people have about visitation and outings. So now I want to transition to staffing requirements. So currently there is no mandated staffing requirement on the federal level. However, starting January 1st of next year, New York State has adopted minimum staffing requirements for nursing homes. So now the requirement for New York State is that each resident should have at least 3.5 hours per resident per day of either a registered nurse or certified nursing assistant or a licensed practical nurse. And they break that down to be about 2.2 hours per resident per day for a CNA or 1.1 hours per resident per day for either a registered nurse or a licensed practical nurse. It's important to remember, though, that this is just the minimum requirement, and facilities should always try and go above this. It's important to remember as well that the facility still needs to staff based on the needs of the resident. So if the resident needs more than 3.5 hours per resident per day of staffing, then the facility should be providing that. And if the facility is not meeting these minimum requirements or they're not meeting the needs of the resident, it's important that you speak up and you ask why they're not meeting these needs and what they're going to do in order to meet these requirements. So a great tool for residents and their families are resident and family councils. And resident and family councils allow residents and their families to join together with other residents and families at the facility and to discuss various concerns that they have. So many of the things that I just went over as far as the staffing requirements, as far as concerns with visitation and outings. This is something that can be addressed in a council, and the council can offer suggestions regarding their concerns to the facility. And the facility is required to consider and act promptly on these grievances and recommendations. So if you would like to be a part of a resident and family council, I would go to the facility and ask if they already have one. And if they don't have one, I would ask what can be done so that one can be started. So we covered a lot of information today, but a lot of residents and families may have quality of care concerns. They may have concerns about the staffing level at their facility. They may say that the facility is not meeting or following the guidelines for visitation, and they want to know what they can do. So one of the things that you can do is to file a complaint. And there are three different ways that you can file a complaint. The first one is with New York State Department of Health. So the New York State Department of Health investigates complaints and incidents for nursing homes and adult care facilities that are related to the federal and or state regulatory violation. And this is important because this means that the New York State Department of Health is able to issue citations or fines for violations. And you can file a complaint with New York State Department of Health two ways. You can do so by filling out the complaint form on the link provided, or you can call the intake line. And just as a reminder, this is also the same number that you can use to start the appeal process for an involuntary nursing home discharge. So what you would do is you would just call the number and there would be a prompt directing you to either filing a complaint or to start a nursing home discharge appeal. The second way that you can file a complaint is with the Long-Term Care Ombudsman Program. And the Ombudsman Program is a federally mandated program, which means that there's one in every state. And the Ombudsman Program is a great resource for residents and their families. Ombudsmen are resident advocates, and they assist residents in nursing homes, and they can investigate and resolve quality of care complaints on behalf of the resident. They can also participate in care plan meetings. And if you're not getting your care plan meeting, or you're having trouble setting up a care plan meeting, if you're having trouble with discharge planning, or the facility is not working with you on your discharge planning, this is an area that the ombudsman can get involved, and they can help to make sure that these things are being done. So the Region 15 Ombudsman number is listed here, and that's for Chautauqua, Cattaraugus, Erie, and Niagara counties. And if you don't live in those counties, then I also have provided the number to the state ombudsman and also the link so you can look up the ombudsman program in your area. Lastly, you can file a complaint with the New York State Attorney General Medicaid Fraud Control Unit. And this unit investigates and prosecutes abuse and neglect of residents in nursing homes. And there's two ways that you can file a complaint with the Medicaid Fraud Control Unit. You can do so by filling out the comment form online, or you can call the state number listed. I also have listed the regional office number for Buffalo if you're in the Buffalo area. So the Center for Elder Law and Justice has some resources that are available to residents and their families. So we have the Senior Legal Advice Helpline, and this is a helpline that operates from 9 a.m. to 11 a.m. Monday through Friday. And if you call during those hours, then you can speak with an attorney, and they can help answer any brief legal questions that you have. And if you call outside of those hours, you can leave a message and an attorney will get back to you within 2 to 3 business days. You can also send an email to the helpline and leave your name and number, and an attorney will get back to you as well. And this service is available to everyone, not just in Western New York, but across New York State. And if you live outside of our service area, then what we're able to do is to provide you with resources and services that are in your area. You also can call our main intake line for potential representation. So like I said earlier, we can help with nursing home discharges if you would like to appeal that discharge. Before, like I had mentioned with the Medicare, and if you would need help appealing if they're stopping your services, or if you had a Medicaid denial, a private insurance denial, those are things that we can help with as well. We also have a consumer unit, an elder abuse prevention unit, a kinship care unit, a housing unit, and so much more. So if you are in the Western New York area and you may need potential legal representation, please give our intake line a call. And I just want to end with some important resources. So first, New York Connects is an organization. They help identify the best available long-term care options for you or your loved one. And I've provided the number with the links to New York Connects as well. And we also have listed some guides for nursing home resident rights, just to provide you with some more information. And the Western New York Independent Living Center is a great resource for a lot of people living in nursing homes. So they have the Open Doors program, and that program assists residents that are living in a nursing home transition back into the community. They also have a Medicaid application assistance program. So if you're in a nursing home or even if you're not living in a nursing home, if you need help applying for Medicaid, they have an assistance program that can help you do that. So I just want to thank everyone again for joining. If you have the time, please complete a quick survey that we have, and I provided my contact information here if anyone has any additional questions. Thank you.
Thank you, Bria. We do have a couple questions. The first one is it required for a physician at the facility to meet with the individual in the first 48 hours?
I don't think it's required within the first 48 hours, but definitely during when you have the comprehensive care plan, that's definitely a time that they need to meet with the resident.
Okay, and the next one for discharge planning, how many days before discharge is this to be created?
So discharge planning, that's usually a part of that comprehensive care plan that I talked about that happens within the first 21 days. But if the resident knows beforehand, if they have a timeline of when they think that they would want to leave, then that's something that they can get started ahead of time. So there's no like set time frame of like when it has to be completed, but just making sure that they have enough time to set up all the services and everything that they need before they leave the facility.
Okay, and then there's one more question. If a facility is discharging consumers due to medical insurance coverage, is that legal?
Can you repeat the question?
If the facilities are discharging a consumer due to medical insurance coverage, is that legal?
If they're, I'm sorry, I'm missing the middle part. If they're discharging due.
If they're discharging a resident due or the patient due to medical insurance coverage, so would that be legal based on your coverage? They could discharge you.
So saying that they have coverage or they don't have coverage.
It looks like they have medical insurance coverage, but maybe it's not the correct coverage. There's not much to elaborate on there. So maybe just wait a second, see if they'll type something else in.
Yeah, so that one, I mean, so one of those 6 reasons that I had listed was for failure to pay. So if the resident was not paying, then that's a reason that they could be discharged. But I mean, if they have coverage and they're being, and that's the like Medicare or Medicaid is like paying for their stay, then I don't think that would be a reason for discharge. It wouldn't fall into one of those reasons.
They did just follow up after 21 days, a copay comes into play and they are discharging them because of that. Is that just a specific question?
Yeah, I don't think I'm fully understanding, but that might be a question where you can call the helpline. I'll put that number up again to call our legal advice helpline, and they can give you a little bit more specific based on that situation.
Okay, well, I think that's it. Thank you so much, Bria, for spending the morning with us and letting us know about all this new information. Thank you, everybody, for joining. I hope you will join us again tomorrow at 10 o'clock. Our topic is asset protection for long-term care expenses. Thank you again, Bria.
Thank you.